Welcome to video number 6 for the skeleton, chapter 7 and 8 in anatomy. In this video we're going to look at the anterior view of the skull. So here we have a lot more bones than we've talked about before. And this is probably the most involved picture and view. So we have the frontal, the nasals, the maxilla. There's two of those. We have the mandible, the zygomatics, and the eye orbit bones and nasal cavity bones. And we'll talk about them a little bit more in depth. So if we start looking at these bones, the first thing that we're going to talk about is the frontal bone, and that is this bone right here. So this is the biggest view we have of this, and we actually have two features on the frontal bone that we're going to talk about. And you can see it's kind of partially shaded here, but right here is a flat area. That flat surface is called the glabella. And on either side of that, right where your eyebrows are these two regions right here. These are called the supraorbital ridges. And we'll talk about what those are in the nose. So you can actually feel those. So the brow ridges are right above, and then there's a flat area right above your nose. So you can feel that by pressing on your skull. These are a remnant, the ridges of our Neanderthal past, because Neanderthals, their frontal bone wasn't as prominent as Cro-Magnon men. Their foreheads actually slanted back and gave very large brow ridges. And one of the hallmarks of modern human, or Homo sapiens, modern humans, is our larger frontal region of our brain, which deals with emotion and processing information. So, I know it kind of makes a funny picture on our skull, but those are the areas. So the frontal bone, what we want to do is talk about the supraorbital ridges, which are our brows, and the glabella, which is the flat area medial to our ridges up here. So it's right above the nose, and you can feel that. The next thing that we'll look at is this area right here, the eye orbit. So this is actually a very large fossa. We have a lot of bones that form the eye orbit. So you can see that we have the top part is the frontal bone on both sides. But then we have other bones. So F right here is the sphenoid bone. You can see that the sphenoid is also right here. So it's appears in a couple different places. So we have the sphenoid, which travels from this side to this side and makes an appearance and forms the majority of the medial posterior aspect of the eye orbit. D on this picture represents the temporal bone. And again, we have two of those, so that it appears on both sides. J, which forms part of the eye orbit, is going to be the zygomatic bone. L is the maxilla. So it forms this part and the side of the nose, and it separates right here. And then you can see that we have two pieces that form this odd shape, and we have half of our teeth on each of our upper jaw on both sides. And then we have two little bones inside of here. So E, which makes an appearance here, and also here and here. So E actually goes across the back of this area and makes an appearance in the eye orbits here and within the nose cavity in these three spots. That is called the ethmoid bone. So it's there, there, and there. I know that makes it a little bit hard to see, but we can see all of these different areas where the ethmoid bone is. I is the lacrimal bone. And if you want to just label those over here instead of drawing the arrows, that's fine. The lacrimal bone is where the lacrimal gland is. And that is just a fancy word for the tear gland. So if you remember that that one is the closest where your tear duct is, there's a little bone in there called the lacrimal gland. So we have all of the features of the eye orbit that come together to form that shape. And if we look at the orbits, we can see that it is a posterior or posteriorly directed fossa, and it's actually cone-shaped. It's not round like most people think it is. So it actually shrinks towards the back and forms more of a cone shape. There is an opening in the back for the optic nerve to travel into the brain so we can see. We also have a lacrimal duct that allows tears to flow onto the surface. And there is one particular area that is rather weak. The joint between the frontal and zygomatic is weak. So, right here, this area right here is rather a weak spot. And this is an area that is often fractured with boxers or with people that get into fights and somebody hits them on the side of the eye. This area of the temporal right here, where the sphenoid comes in, is also a thin area. And this is, if somebody is struck very hard here, it can actually be fatal. So those are a couple weak spots. The nasal cavity, if we look, we have G, which is our nasal bone, and there's two of them, so it separates right down the middle. Then we have those three parts of the ethmoid, N refers to the inferior nasal concha, and H, which is right here in the middle, is called the vomer. So the sides of the nose up above are the nasal. We have some bones inside, but this is where the cartilage would be, where we can bend our nose back and forth. But the maxilla are the sides that creep up, and you can actually feel these different areas as you go up your nose. So the maxilla goes up and meets up with the nasal, but on the inside, this forms the nasal septum, or that middle part that separates the nasal cavity into two parts, and then we have these bones that stick out. So when we look at the exploded version, we can see that these bones, the ethmoid, is actually one bone, but it appears in different places, kind of in the middle of the head. So the nasal cavity is separated by the nasal septum. The bony part is made up of the vomer, the nasals, the ethmoid, and the inferior nasal concha. And the flexible part is cartilage. So if you hear of people having a deviated septum, that means that these bones might be misaligned. And if you break your nose, more than likely you break these bones up here and they're shifted out of place, and the doctor will go in and take your nose and push it to put these bones back into place. But you end up with a lot of bleeding underneath the surface here, and usually underneath your eyes are going to be black and blue. They can go in and reshape these bones and break things in here when people have rhinoplasty, which would be plastic surgery on the nose to alter its shape. The other thing that we will mention here is the mandible. And again, here is the body, and here is the ramus. The rest of these you are not responsible for, but the mental protuberance is just your chin. So that's the part that sticks out. So the final thing we'll talk about are the sinuses. The sinuses are air-filled cavities within the bone. They serve to warm and moisten air that is breathed through the nose. They help resonate your voice. And they also decrease the weight of the skull. And we have 4 sinuses, and I'll put up a picture of where these 4 sinuses are located. But we have the frontal sinus, which is located in the frontal bone. The sphenoidal, located in the sphenoid bone. The ethmoidal, and the maxillary sinuses. And these sinuses can give people a lot of trouble. And that is because the drain for these sinuses is at the top, not the bottom. So they tend to fill up with fluids, mainly mucus, when we have an infection in there. It's an evolutionary feature because we walk upright, whereas if we walked on all fours, our heads would be more down and they would drain a lot easier. So this is something that really just hasn't caught up with our evolution yet.